يعطيكم العافية. شكرا للجنة المنظمة for having me. وشكرا لكم كلكم انكم حاضرين في هالوقت وفي إجازة، ويعني putting the effort ان انتم تحضرون to find what's really your thing. يعني شكرا خصوصا يعني ما اقدر احضر الاسماء كلها، بس آية والشباب اللي تواصلوا معاي يستحملونا في ترتيب البرزنتيشنز والاشياء هذه، يعني really grateful. ولكم انتم اللي عبوا معي السيرفي اللي نشرته على تويتر to help me يعني guide you better يعني. طيب زي ما تفضلوا الشباب والمودريتورز، يعني my talk will be about what I believe personally is the best field of medicine. ممكن أكون أنا biased شوية. طبعا حغطي معاكم أنا my time I spent as a general surgery resident is very brief, so I will cover from what I have seen so far. The things that I haven't seen will be covered from my mentors' experience, my mentors' point of view, and literature. Also, يعني أنا research is a really big part of my interest. So I always try to implement it in everything I do. طيب without any further delay, التوك حقي حيكون بالتايتل General Surgery between the hot lights and the cold steel. The name was inspired by Michael Collin. هو كتب كتاب بعنوان، صراحة أنا أخذت التايتل من عنده يعني Hot Lights, Cold Steel, Life, Death and Sleepless Night in a Surgeon's First Year. كتب عن الاكسبيرينس حقته what general surgery residents see and what do they have to deal with. I was يعني really inspired by the title for a reason إنه usually it reflects الهوت لايتس اللي تشوفونها هنا عندكم في السكرين، إذا واضح عندكم السلايد. Between the hot lights of the operating room, usually these lights احنا اللي نسخن في عمليات it's really hot. It's يعني it emits heat, and the instrument we deal with are usually made of steel, and they are really cold. So what's between this hot light and this cold steel is the surgeon. Disclosure اللي عندي, I have nothing to disclose, but beside the bias, as I said, يعني I still really believe in this is one of the best fields you can get yourself into. طيب, without any further delay, ايش الاشياء اللي انا حاب اغطيها. I try to cover most of the things that you asked me for, a few things من عندي. فاول شيء يعني بنشوف احنا what do we deal with as general surgeons. What is really is it really a general surgery, general surgery local programs, general surgery curriculum by Saudi Council, the pros and cons that you believe that are pros and cons. What does the literature have to say about them? The future in general surgery, very humble, small take-home message. طيب, as general surgeons, what do we see? يعني most of our elective cases, مثلا في oncology, where I do my training, we do مثلا the most common cancers في عندنا في السعودية, breast cancer, thyroid, colon, or other GI malignancies. The other things اللي هي most common procedures we do in the secondary hospitals, اللي هي most of the hospitals عندنا في السعودية, appendectomies, diagnostic laparotomy و laparoscopy, would be definitive procedures زي cholecystectomies, bowel resection and whatever, breast surgery, thyroid, hernia repair, the common things that you usually see. Top emergencies, that when you are working during the night you will be called for, disease related to gallstone disease, biliary tree disease, trauma, which is a very big chunk from surgery, which I believe also is really one of the most appealing parts of general surgery. Again, acute appendicitis, acute pancreatitis, and one of our favorites, perforated viscus. طيب, is really general surgery a general specialty? يعني ما أدري إذا if you can share with us على الشات. I think most of the people يعني اللي أعطوني comments على survey كانت من drawbacks حقتهم إن general surgery is a general field. يعني أنا ليش أدخل في تخصص في النهاية أو be called a general surgeon. فما أدري, أنا ماني شايف الشات, إذا ما أدري moderators معي. I cannot really see it. So yeah, اوكي الشباب, عندي الانترنز عندنا من جامعتكم موجودين, حياكم الله. الانترنز عندنا من جامعة الملك فيصل. shout out to all of you, صراحة you are really amazing. يعني شيء يرفع راس صراحة. طيب back to the topic. Is it really general surgery? Is it really general? طيب هذا كان one of the big drawbacks in most of the people and they think and it's a bad thing in general surgery. I'm here to prove you otherwise. طبعا general surgeons used to يعني لما نتكلم back in the day general surgeon لما تخلص البورد general surgery you can do anything. خلاص انت وصلت almost the top of the pyramid. You can perform any procedure, abdomen, chest, pelvis, retroperitoneum, vascular, thoracic, you name it, neck. This is the old school. Now a general surgeon can only do fundamental basic parts of general surgery. What's really the future is اللي هو subspecialties of general surgery. Okay, so you can see here 13 subspecialties. هذه إذا يعني نتكلم بالبرود term. Trauma, acute care, تقدر تشتغل في الاي سي يو even you are as a trauma surgeon تشتغل في الاي سي يو حالك حال مع يعني تقريبا زي الميديكال اي سي يو بس for surgical cases. Minimally invasive, robotic hand assisted robotic, laparoscopic, mixed of both. colorectal surgery. طبعا colorectal surgery و other specialties تشمل benign diseases والانكولوجي اللي هي المالجنسيز. upper GI, breast, hepatobiliary, vascular من تخصصات اللي قاعد تقل فيها surgical point of view, but what's going on the top with it is endovascular interventions زي ما قال الدكتور أحمد. زي ما في عندنا في cardiology they do intervention. Now general vascular surgeons they do open repairs for whatever vascular disease. They also do it endovascular اللي يخشون من الفيسل with catheters. They also do intervention radiology. فأنت intervention radiologist, you are a vascular surgeon and you are an endovascular surgeon. Endocrine, transplant, one of the really things that يعني it's a life-changing field. يجيك المريض, they do dialysis on weekly or whatever basis. They walk out from the transplant, they recover, they're back to their normal life. Surgical oncology now it's more of a limited لأن الانكولوجي تقسمت على subspecialty, thoracic, cardiothoracic, pediatric. أنت تخيلوا pediatric surgery after you finish general surgery or you join pediatric surgery من البداية, you can do a subspecialty in all of these يعني general subspecialties اللي نسميهم. البلاستيك فيها البيرنز فيها reconstructive فيها الهاند يعني it is an endless subspecialties with subspecialties. So it's not a general surgery, it's just the name we used to call it يعني. طيب ايش البروجرامز اللي موجوده عندنا؟ ما حتدخل كثير في الموضوع هذا لانه ما حيفرق كثير as a field, بس as a training اللي عندنا اللي هو Saudi Council for Health Specialties. هذا الهيئه السعوديه للتخصصات تعطي accreditation للمستشفيات اللي فيها general surgery program وفي university program which is a new concept عندنا على الاقل في السعوديه. as far as I know اللي في الشرقيه موجود حاليا فقط تبع بروجرام جامعه الامام عبد الرحمن بن فيصل او جامعه دمام. بروجرام عاده البروجرامز هذه تكون affiliated مع other universities موجوده برا to get the accreditation. العيب في هذه البروجرامز انه it's not really well structured yet, nobody will sponsor you so you have to pay for your training. The other thing is لما تيجي تخلص البورد حقك you want fellowship whether local or international, you are not accredited. This is a new program. فما هم عارفين المخرجات حقتها. The other thing, you cannot really rotate between hospitals لأن you're not accredited by Saudi Commission. فهذه one of the drawbacks بس حبيت إني أوضحها لكم. طيب لما أنا أتكلم الحين في الديتيلز حقت الجنرال سيرجري تريننج بروجرام في السعودي كونسل يعني تبع السعودي كوميشن. It's a 5 years training program. شوية طبعا تختلف عن التخصصات الميديكال by one more year, which is يعني understandable لأن أنت you need not only knowledge, you don't need only to read, you need to work, you need to see more cases. يعني no matter how many يعني لو تقرأ الأبندكس كل كتاب موجود عن السيرجري, you will never be able to do it unless you see it and being supervised. فذاتس واي انت عندك سنوات اكثر. طبعا زي ما الدكاتره قبل بيشرحوا احنا عندنا الجونيوريز 1 R1 R2 R3. اول سنه غالبا نغطيها في جنرال سيرجري, ثاني سنه ميكس بين جنرال سيرجري وسيرجيكال سب سبيشاليتي وسبورتنج سبيشاليتي زي الاي سي يو الامرجنسي ميديسن, ويكون عندك elective 6 weeks وفيكيشن of 4 weeks في كل سنه من السنوات. بالنسبه للسينيور يير هي R4 R5 تقضيها في الجنرال سيرجي خاصه عشان انت تكون جاهز to be a board certified general surgeon. الاكزامز يعني ما بتكلم عنهم كثير بس maybe يعني it's almost like most of the other specialties في السعوديه التخصصات تتبع السعودي كونسل. عندنا yearly promotion exam يكون oral written وفي part exam to be promoted from junior to senior وهذا usually يكون written والفاينل board certifying oral and written exam. إذا خلصت إيش حتكون board certified general surgeon a specialist على حسب يعني نظام المستشفى والمكان والأشياء is changing but usually you spend 1 or 2 years then you will be a consultant or you will go abroad or locally to do your fellowship and you will be sub-specialized in your يعني specific field من التخصصات اللي sub specialties اللي ذكرتها وتشتغل الأشياء general surgeon plus الأشياء specific for your field. طبعا another thing كانوا يسألوني في السيرفي when can I work as a first surgeon لما ندخل عمليات في general first surgeon first assistant second assistant. First surgeon هو the one who do the surgery almost all of it يعني طبعا with assistant. طبعا تختلف في اول سنه في procedures you should do it by yourself مثلا incision drainage appendectomy hernia repair بس under the supervision. طبعا the more senior you become the more procedure you will do. So from R1 I guess you can really be the first surgeon. طيب the pros and cons يعني this is من التخصصات اتوقع اللي فيها كثير ممكن حتى الكل بيشوف الكونز more than the pros ممكن حتى انا مع كلامي ممكن حيطفى الكونز بس هذه لها تعليق علي في النهايه. طبعا ايش الاكسبكتيشنز is it going to be like Grey's Anatomy يعني ORs are always fun you always get to save the patient you always get to be the hero or always to do the life-saving procedures وانت the one and only general surgeon who can save the day or is it really like this يعني you get to sleep after doing 14 hours procedure أو زي ما أنت ماسك you're holding for your consultant or your senior retractor or whatever the limb where they do the major of the part for a few hours and you get to sleep while holding it and it happened or يعني من الجنرال surgeon الجنرال surgeries يعني اللي احنا نسميهم dirty ممكن يسمونهم dirty fields يعني ما هم من well dressed specialties where you get to wear your tie you get to carry candy in your pocket for your patients زي ما قالت الدكتورة it's really more of a grunting work but is that the reality is that all of it خلونا نشوف. طبعا هذه pros and cons معظمها كانت منكم يعني حتكلم هنا شوي وهنا شوي. في عندنا الاشياء اللي انا really يعني it's my really top thing my top favorite thing في الجنرال surgery is the variety of cases. يعني ممكن اشبهها شوي في الامرجنسي ميديسن من الاشياء الحلوه برضه في الامرجنسي ميديسن. يعني you work with adults you can work with pediatrics في adults you can work with young adults and elderly adults. You can work with elective cases. You can work with emergency cases. And emergency cases could be life-saving. You can push the patient from ER to OR in the same time. And you have emergency cases that can wait for a few hours. You have oncology cases. You have secondary cases, appendix, lap coli, الافتاق, الhernia, الأشياء هذه. We also have the transplant cases. فيعني it's really يعني متشعب بطريقة فظيعة. هذه تخليني ما أشوف من الناس اللي كانت تقول I'm afraid I get bored. هذه يعني it's quoted from the survey اللي عبيتوه. فيعني it was really strange. يعني in general surgery if you really like general surgery you will never get bored. Appendix اللي لو ممكن كل يوم in your training تدخل appendix you will never see an appendix looking like another. There is no twins in general surgery. Every tumor, even if it's in the same place, even if the same size, if the same histological type, يعني even on the cellular level, it will be different. The supply حقها will be different. The compressing of the adjacent organ will be different. But you will never get bored. وهاي من الأشياء حلوة من الأشياء شوي ممكن تكون يعني سلبية عند البعض إنه it's not only about reading. يعني أنت if you have an MI to some extent and you know the approach to MI, you will be okay. مثلا if you have مثلا colorectal cancer, you have the approach, you know how to do the staging, but when you get to the OR, your reading is not enough. Even if you know to do the procedures, يعني the procedure or the resection, يعني skin to skin زي ما احنا نقول, it's not enough. يعني you need the experience, you need the exposure. فيعني شوية هنا وشوية هنا. Good income for the private, yes, in certain some specialty. Good rewarding outcome, yes, يجيك patient trauma, not conscious, his own active CPR, limb is amputated, يطلع لك limb is back in place, patient is talking to you. يعني you can see the two spectrum of life and death. Prestigious, some think of it yes, some think of it صراحة the opposite, as ما قلت لكم one of the dirty specialties. Good private sector, yes, if you make it there. It's a teamwork. يعني general surgery is not a one-man show. Usually كل واحد في التيم له دور مرة مهم. يعني حتى احنا interns أنا دائما أقول لهم عندنا في هذا يعني even the intern has يعني ما له غنات عنا في التيم. يعني انت لك دور، الجونيور له دور، السينيور له دور، السبيشالست له دور، الكونسلتنت له دور، كل واحد له بارت. يعني انا which I really like it. يعني تحس ان انت يعني you're counting on each other. It's a team based specialty. It's ever changing. دائما في new techniques, new procedures. يعني اللي كان يشوف very simple things. يعني اللاب كولي قبل كم سنه كانت open procedure. now اللي يسوي open lab كولي for simple biliary colic or gallstones. يعني it's really not acceptable. But it is really changing the field. يعني كان عندنا open, now عندنا laparoscopic, and the future going toward robotic, and robotic حتى even telerobotic, which is يعني really interesting. طب نتكلم عن الكونز الكثير اللي يخاف منها في الجنرال سيرجري. I'm afraid that I will harm the patient, the stress, يعني also the work related injuries. يعني انت if you lose your hand, if you lose your sight, that's it for you. يعني you're done as a general surgeon or as a surgeon حتى. rarely to be accepted in فوش رح اتكلم فيها في النهاية يعني على قد my humble knowledge. The time to acquire skill. You need a really good time, good exposure to know about this. هتكلم عن هذه الأشياء شوية في الليترشر. يعني ما أبغاكم تقولون عبدالله القطان قال لي ولا فلان قال لي ولا الانترن اللي خذا تريننج ولا الستودنت اللي خذا summer training surgery قال. أنا دائما I say what does science has to say about it, about these pros and cons. إيش يخليكم أنتم تختارون general surgery؟ إيش يخليكم ما تختارون general surgery؟ فخلونا نشوف. طيب locally ايش اللي موجود في الليترشر؟ هذه one of the papers that I really like. Very simple paper done of one of my mentors دكتور محمد الشهراني مدير المستشفى في المكان اللي انا خرجت منه في مستشفى الملك فهد الجامعي بالخبر. وزعوا survey وشافوا ايش الفاكتورز that influence medical student choice in choosing their future specialty. One of the independent factors يعني factors ما قاعد تتاثر باشياء co-founders ثانيه نسميها في research او اشياء يعني if coexisted could affect this. يعني it's an independent factor for choosing a specialty is male and female يعني gender of the applicant. Interestingly كثير عندنا لو تسمع يقول لك الجراحة ما هو تخصص حق الفيميلز. This is for you يعني our female colleagues. This is not true. This is science proven يعني at least locally. يعني لو تلاحظون ال p value هنا it was not affected by the gender. whether كانت مع الانترنز او مع الستودنت as well. ف is it difficult, more difficult for female? Yes, of course. Is it an obstacle? Maybe. But is it something that prevents you? Definitely not. أنا يعني most of my mentors ممكن يكونوا female surgeons. I really look up to them. يعني I owe them a lot. في تخصصات ثانية did influence their specialties in emergency medicine, family medicine. يعني وتختلف طبعا من مكان إلى آخر. طيب what else ايش شافوا اشياء ثانيه انتم تكلمتوا عنها وتسالون عنها ما كان في اي شيء really يعني made a difference. منها intensity of the training, prestigious, controllable lifestyle واللي كثير concerned. I think it's the most concerned in general surgery. ما كان في فرق affecting really their choice. يعني who really wanted surgery ended up in surgery, and who really did not want it ended up, regardless of the lifestyle, regardless of the prestige, regardless of the income. This is really important. يعني لما when you choose something, especially يعني something will be really committing. General surgery أو أي تخصصات ثانية. يعني general surgery is not the only granting specialty. بس يعني حتى لو دخلت التخصصات الثانية ممكن اللي ما فيها physical stress or things that you need to take decision on point. يعني make sure you really choose the something that you really love. يعني مو شيء عشان الشباب دخلوا فيه بدخل معاهم، مو شيء عشان حيقبلوني حدخل معاهم، مو عشان حتى درجتي تدخلني حدخل. الدرجات تروح وتجي، ما قبل السنه هذه حتنقبل السنه اللي بعدها. الشباب ما حتشوفهم حتى لو كنت معاهم في نفس التخصص، ترى عادي يعني. choose whatever you like لأن this is the only thing that will get you to the end of the way. This is the only thing اللي حيخليك أنا لما emergency medicine زي ما قال الدكتور يشغلونا طول الليل. ما يشغلونا طول الليل طبعا، هم من الناس اللي they are front liners زي ما يقولون. تروح وانت سعيد الامرجنسي روم الساعه 3 الفجر وانت مو نايم، واقف في الصباح كنت في العمليات ومناوب في الليل، تروح وانت سعيد لان this is what you really want. ف choose really what you really want. Find your passion and follow it all the way. طيب again حتشوفون امشي على papers كثير بس just to prove a point انه ما هو نطقا عن الهواء. resident satisfaction. طيب انتم تقولون طيب انا دخلت بس would I be satisfied في التريننج بروجرام في السعوديه وسبيسيفيكلي في الشرقيه؟ and this paper is one of them is our current chief president, our regional program director دكتورة حصة، دكتورة منال نعيمي, one of my biggest mentors. شافوا البيبر هذا وزعوا على الريزيدنت جنرال سيرجري ريزيدنت في الشرقيه كامله، الحسد، دمام، كل الشرقيه. الشوكينج is 44% are not satisfied with their training. بس here's the catch. هل هم ما هم سعيدين in their training program؟ هل هم they regret their choice؟ No. Their dissatisfaction was لو تلاحظونها هنا موجودة is the research opportunities. وكانت most of the disappointing point. The faculty, they are not dedicating time for their trainees and their mentorship with case volume. Most of these things are, it depends on you. يعني research, you have to look for more research. You have to invent your own ideas. You don't have a mentor, look for a good mentor. There are many mentors. And I have in this number I can probably call mentors. So I think this really have to be considered. They're not satisfied, 44%, but whatever they are not satisfied with is really not a big deal because you can fix it. It's in your hand. طيب internationally حمروا عليها سريعا لان it might not apply to us. US medical student شافوا ليش ايش الاشياء اللي تاثر عليهم يختارون السيرجري. عشان الوقت بس حمروا على هذه النقطه، الستيريوتايبنج ان الكل يقولون السيرجري توكسيك انفايرمنت، كثير قال منكم توكسيك انفايرمنت، they are very blunt, difficult to deal with, يعني تريني معذب في الارض حق الجنرال سيرجري. طبعا هذا this is one of the misconceptions. It is there وحتكلم عنها الحين حتى على السريع. بس يعني لو تلاحظون في البيبر هذه هنا يعني one of the things اللي كانوا يتكلمون عنها إن this is يعني really misconception by peers, reflection by other specialties. الشيء الحلو إنه what affected it, which is a really big believer اللي هو الكليركشيب والإكسبيرينس. وبرضه يعني الكليركشيب هما يعني ما بين الانترنشيب وحتى البري كلينيكال exposure. ان انت لما تاخذ training to general surgeon لما تشتغل مع really general surgeons you know how you will be respected, you know that your word is valued. انا اليوم as an R1 كنت مع one of the senior pediatric surgeons in the middle of the procedures. بعد ما خلص whatever major steps لف علينا واحد including nursing, including anesthesia. Anybody has a suggestion? I'm sure 100% he knows every other option and what's the best option for the patient. بس في النهاية حط for my own يعني presence a value for OR. I suggested something, a step to do to check for something, and he said I don't think it will make a difference but I will do it. It did not make a difference and he did it يعني just for the sake that you are a member of the team. I think this will apply to a lot of things. But my advice is if you are concerned about this, take general surgery, take an elective, really get deep into it. اختلط مع resident, اختلط مع consultant. You will know that this is a misconception in most of the cases. نفس الشيء. I have 2 minutes I know. The same thing هنا تكلموا عن exposure, lifestyle. شافوا برا ان lifestyle is the most important factor making student go away from choosing general surgery. بس زي ما قلت لك في ناس كثير يقولون life is a lifeless specialty. بس it's really what works for me does not necessarily works for you, does not work for her or him. يعني انت شنو حاب تختار في حياتك؟ My balance is not your balance. My balance in the weekend لو اطلع يوم الخميس واروح عليه الخميس وانا طالع الساعه 10 بالليل from a Whipple procedure I would be really happy. ممكن حتى انا اي من الشباب موجود معي او اضيع الطلعه ولا انقعهم كم ساعه I would not regret it. I'm happy. بس واحد ثاني يقول لك لا I like a more balanced life. ما احب الانكوز، ما احب الاو ارز تقطع علي حياتي. choose whatever it's suitable for you. bullying it's there. بس النقطه الوحيده اللي بذكرها هنا على السريع ان البولينج if you can notice here في الجراف هذه one of the papers تكلمت عن البولينج في general surgery. هذا البولينج that has been يعني encountered by residents وهنا the bullying that was encountered by the consultants. Yes, even consultants get bullied in surgery. I think this is not only in general surgery, it's in all field. ولو تلاحظون هنا لو نطالع more of the trainees and residents إن شاء الله أنتم في المستقبل تلاحظ إن more than 50% is not actually by your senior consultant. it's by the administration, it's by the nursing, by your other colleague trainings. فهذا ممكن يعطيك فكرة ان المشكلة not in the specialty itself but in the environment and where you work in. هذه study ثانية, it is the best thing I could found. معلش أنا ماشي study كثيرة بس يعني again just to make a point.
دكتور عبدالله البحث عن الالتزام يعني.
أيوة بس I just want to make a point. If you look at it here, سألوا هذه كل resident في general surgery across the US, which is the biggest country with trainees. Most of them were happy with what they are doing. They were happy with their work. They love going to their work. They also have the concern اللي كثير عندكم, I might hurt the patient. That's why you are not never working alone in the OR or the ER or the ICU. I always have. طيب آخر شيء حختم. sub specialties كثيرة. الفellowship موجودة في local programs, so you don't have to worry about that. الجوبز هذه من وزارة الصحة, المستشفيات شغالة فيها وزارة الصحة يعني السعودي general surgeons. It's only 20% from all positions. But there is a need. There is a need. ممكن مو not in your local hospital, but there is a need. طيب, take home message, don't get into general surgery if you don't really like to be waked up for 1 in the morning for a patient who has been stabbed. It's a specialty that تقدر تشوف انت اللي اشتغلت بيدك ايش الاوتكم. يعني دائما كانوا يقولون consultants, your suture on the skin is your signature on the patient. if you really like to see your outcome, الليالي اللي سهرت عليها اللي تعبت عليها على المريض في نفس اللحظة, this is the place for you. آخر شيء just a few quotes for you. ممكن ده أتكلم عن الستريس, أهم شيء في الجنرال سيرجري. دكتور خالد ophthalmologist, a very dear mentor, كان يقول مرة إن life is nothing without stress. Stress is what gets you out of the bed in the morning. Stress is what makes you build you. يعطيكم العافية وعذرا على التأخير. I skimmed very quick, but there is a lot to cover. This is my email, my Twitter account. Thank you again for the organizing committee. Thank you for attending, for taking from your time to build you يعني. الله يعطيكم العافية.
الله يعطيك العافية دكتور, شكرا جزيلا.